In congenital heart disease, as a result of significant advances in pediatric cardiology and surgery, we now have most people born with congenital heart defects who are reaching adulthood. And for the first time in history, we now have more adults living with congenital heart disease than children living with congenital heart disease. And that's one of the main reasons that we're focused on the transition from pediatric to adult care. And when we think about transition, we have two main goals. So the first is that we want to keep people retained in really optimal cardiology care. And so what that means is we need to make sure that we tell people that they should be in care and the importance of lifelong care. We need the young people to understand and to agree that it's important that they stay in care. And we also need to have people who are well qualified and able to see them. Historically, a lot of people have had lapses in care. So one recent study showed that about 40% of young adults with congenital heart disease had had a gap in care of at least 3 years or longer. And the problem with that is when people eventually represent to care, we know that they have significantly poorer health outcomes. We also want to focus on education and self-management skills because we want to create a group of young people and young adults who are ready and able to manage their health care as adults and able to lead as rich and full a life as possible. And we used to think, until just a couple of decades ago, that brain development finished when people turned 18. And now we know that it continues through the 20s and even into the early 30s. And what this means is when we talk about working with adolescents and emerging adults with congenital heart disease or any chronic health condition, we really need to view them as a unique group of patients. So 18 to 25-year-olds are not adolescents and they're not adults. What all of this means is that if we want to have the best transition outcomes possible, we need pediatric and adult congenital heart disease providers really to work together and to collaborate, and it's really nice to see those kind of initiatives happening.